was laid to rest.
Governor Scott Walker rejects billions of dollars in federal funding to expand the state's health insurance program for the poor and disabled.
The governor says the state and the county need major entitlement reform, but healthcare advocates, Democrats, are infuriated over the decision, which they say places politics ahead of people. Fox 6's Mike Lowe has tonight's political lowdown.
Good evening, Mary, and good evening, Ted. The governor promises that his plan will provide insurance to more people in need and keep the burden off of taxpayers. But his critics say the numbers don't add up.
I was in an accident.
57-year-old Andre Pittman's limp tells part of his story. He says he injured his leg and his back in a car accident. Now he can't work and he needs therapy and medication, which he gets from the state's insurance program for the poor and disabled, BadgerCare.
I wouldn't even be able to afford my medical bills, get my medication, none of that, because as of right now, I'm disabled.
He is one of 775,000 Wisconsinites on BadgerCare, the state's Medicaid program.
We are done.
President Obama's health care law would provide billions of dollars to Wisconsin to pay for the expansion of BadgerCare. But on Wednesday, the governor rejected that money.
Our goal is ultimately about reducing the number of uninsured people in the state of Wisconsin.
Walker says he plans to spend an additional $644 million in his budget to allow for more people to buy health insurance in the soon-to-be-created health care exchanges. He says it would mean more than 224,000 people would be insured.
They'll provide multiple options of affordable health care, and yet at the same time, we're reducing our long-term burden on the taxpayers of the state of Wisconsin.
I'm afraid it sounds like magical thinking.
Healthcare advocate Robert Craig of Citizen Action of Wisconsin says Walker is placing politics before people.
This is about the governor reaching out to his Tea Party base. This is about the governor thinking about running for president one day.
Your critics are accusing you of attempting to undermine the national health care law to benefit your political base.
No, I think what people will be surprised to find out is it's not a yes or no proposition. What we're going to announce is fairly creative. To my knowledge, it hasn't been done by any other governor in the country.
The law says you either take the federal Medicaid money to fill the holes in Wisconsin and BadgerCare or you don't.
As for Andre Pittman, he says he's lucky to be one of the people on publicly funded health insurance.
It's very important because if it wasn't BadgerCare Plus, I don't know how I would have insurance.
And Governor Walker says his decision is part of an effort to reform the state's entitlement programs, and he also proposes increasing requirements to get food stamps. Now, state Democratic leaders are calling the decision disappointing and disheartening, saying it will cost the state both money, some $65 million, and jobs, some 10,000 in the estimate that they're giving. Back to you.
Mike Lowe, thank you. Pope Benedict XVI